So we've touched on some of the sexual wellness stuff, and then you guys also do aesthetic procedures?
Yep.
Okay, so for a layman like myself, what's that mean?
So aesthetics is basically, we offer injectables to help kind of revamp your, facial structures, like decrease the lines in your face, stop some muscle movement that are causing the lines. So we kind of help to try to balance the overall appearance of your face. There are multiple procedures out there. If you Google, there's probably thousands. But the ones I had mentioned that we offer are, Botox or Dysport. Those are basically meant to relax your muscle movement. So the more contractions you have with your muscles, the deeper lines that you may have or may form, over time. So by decreasing some of that muscle movement, you're not going to have those deeper lines. You may still have fine lines, here and there, but in general, it'll kind of like lessen the appearance of those lines. Dermal fillers are usually used to help restore volume. So if we're thinking of, why is this looking like this? Why are these lines looking like this? We kind of focus in the mid-face, saying what's going on. As we age, we continue to lose collagen, starting around like late 20s, even early 30s. So you're maxed out at your collagen, and at that point, everything just starts to like dwindle away. So with that being said, everything in your face just wants to fall. There's no, nothing's kind of holding it up. So when we do look at the mid-face, we actually want to inject, starting in the mid-face, we call it the bra of the face, just to help to maintain and help to support all your structures. So without that support, if you were to fill certain areas of the face in general, you may not be fixing the problem. So you have to go to
The source.
Figure out the source first and then kind of tweak from there.
And you guys come in because you find the source.
Correct.
Right.
I don't need to know the source before. You're going to tell me where it is.
we'll tell you where it is.
There's some
yes.
bony resorption that happens
Yeah.
with aging too, especially around the eyes, or the zygomatic and the mandibular angle can kind of lessen. And so sometimes using filler to just add some of that volume back there. It makes a difference without changing your face. I think when it first started, people would just fill the lines, and we don't.
Well, that's what everyone thinks about aesthetics. They
Right.
think it's like blown out lips, blown out cheeks, blown out that's not what we do. We're more the natural approach, and even a better product out there too is Sculptra. So Sculptra is just a liquid substance. It's injected in certain areas of the skin, and what it does, it helps promote your own collagen to regrow. So back in the day, it was actually introduced to AIDS patients because they had a very gaunt look. So when they used this on their face, it helped them reproduce their own collagen, so they didn't look so gaunt. So basically, if people are like, I don't want Tox, I don't want Botox or Dysport, I don't want dermal filler or whatnot, we can talk about rebuilding a foundation within their skin.
Their own collagen.
Of their own collagen, which is amazing. And that, honestly, for all age groups, starting younger is a great way to be more preventative with all of this. So it's people say it's I'm too young or whatnot, but you have to think of it more as prevention because if you look at your parents, you're probably gonna end up that way. So it's just a
Calling
different
my
way
mom
to
on
put it.
FaceTime.
I know.
What do you have here? What do I need to get done?
Smile.
Yeah. Oh, that's funny.